Welcome, Happy New Year, and welcome back to Montgomery Heart and Wellness. And many of you may have been wondering where we've been. It's been a busy beginning of the year for us, and we've been working on 2025 shows and lots of information. And I'm coming on to you today, and as you can imagine, the title from the thumbnail, we're going to be talking about some of today's events related to the inauguration and the bringing in of a new administration. But again, first of all, welcome back to Montgomery Heart and Wellness. And I'm going to share with you some things we're going to work on this year. But first and foremost, I want to share this topic with you in my first live show today because there's some very important information I think that needs to be discussed regarding the politics around health. Now, I'm not a political pundit, and I don't know where your political stances are, and it's not about politics on one side or the other. However, there's a conversation, a new national conversation about the health of America. And I think it's very important for us to not only earmark this, but pay attention to this conversation and follow this conversation, potential actions. Now, of course, there are a lot of unusual things that happen in this political season, but as you know, the thing that's most important to me was this new conversation about the health of America. Now, every year, or perhaps every political season, there's always talk about healthcare. But this talk about healthcare is usually about healthcare coverage, reducing the cost of private insurance, making Medicare more available, Medicare for all, Medicare for some. However, for the first time that I can remember, we're now talking about, at least from the government standpoint, they're talking directly about the health of U.S. citizens. And this, I think, is a very important distinction because it's always been my feeling that we should focus more on making Americans more healthy as opposed to only focusing on providing them more insurance coverage. So I have a few bullet points I want to share with you in terms of this whole concept of making America healthy again. Many of you may be familiar with it. Again, I'm not here making a political statement, but under this Make America Healthy Again movement has been a number of initiatives, and I'm going to share some of those things with you. Now, first and foremost, I want to ask the question, what are the proposals of this Make America Healthy Again site, and what are they proposing? Now, what I want to do is share with you their site because I think it's worth taking a look at this whole concept of Make America Healthy Again. Let me see if I can bring that site up for you. Hold on 1 second here. Share screen isn't working. But anyway, as we go through this, there's clearly some components of Make America Healthy Again that I want us to discuss. So there are four basic, well, actually about five basic components here. And this Make America Healthy Again, this whole issue of chronic disease epidemic, MAHA's policy focus advocates for a comprehensive national strategy to combat chronic disease epidemic. This includes addressing root causes such as poor diet, environmental toxins, and inadequate health care. Now, this formed as a political action committee. I don't know why they did that. I know it came during the political season. There was a push toward, supporting a certain administration. But the fact that they're going to focus on poor diet and environmental toxins caught my eye and caught my interest. They want to reduce environmental factors contributing to chronic illnesses like cancer, diabetes, and heart disease. That's a very important factor. Regenerative agriculture. They want to talk about regenerative agriculture from the standpoint of Americans' health and environmental changes. I do know they want to support farming practices, improve soil. This may be related to supporting small, local, regional farmers. Habitat preservation, not so directly related to health as I see it. However, environmental sustainability and public health, it's more of a public health initiative. Combating corporate corruption, I think, is a very important component. And I think combating corporate corruption underscores all of these, because I think it's the corporate corruption and the corporation's ability to affect policy, which stands in the way of making smart policy decisions and removing toxins from the environment, harmful chemicals in our food, water, and the air. Again, very important. So these are pretty strong initiatives, and I think they're spot on from the standpoint of what the government can do and what the government should do in terms of making America healthy again. Now, back to my comments, because I think it's important to differentiate what the government can do and what we should do from the standpoint of taking care of our health. So my talk today is going to focus primarily on two parts. What can the government do, and what's their role, and what is our role? And so it's important for us to make this distinction. So let's take a look at what we can do in terms of, what the government can do to improve our health. And I want us to pay attention to this, because this is something we want to follow throughout the course of this year and subsequent years to see if this actually comes true. At the end of this conversation, I'm going to talk about important initiatives for us to take individually, and it's our role at Montgomery Heart and Wellness to share with you things that you can do, that you can start on January 20th, 2025, to start improving your health. Because it's my opinion that the large portion of responsibility lies in the individual. And that's going to be the important thing that we have to take to heart, while at the same time paying attention to what the government's doing. At the end of that discussion, I'm going to share with you some information that we're going to be sharing throughout the year, including a premiere documentary that's going to educate you on how to improve your health. We'll talk about the details of that at the end of this conversation. Also, at the end of this conversation, we'll be taking questions and comments. And I'm going to bring on Jackie Williams in just a minute, who's going to be helping me field the questions. So if you have any questions about anything I say or any comments, please leave them in the comment section. Those of you on the chat, we'll take a look at those and address those at the end of my talk. So let me just get back to the topic at hand. And let's look at how can the government improve our health. Well, as you know, RFK Jr.'s potential role is heading the U.S. Department of Health and Human Services. And so this role is very important, because the Health and Human Services Department oversees a major part of our government as it relates to healthcare policy. So let's look at the overall mission. It oversees health and well-being of U.S. citizens by means of providing health, effective health and human services, and also by fostering sound, sustained advances in the sciences, underlying medicine, public health, and social services. It also oversees public health policies related to what goes into our food, water, air, and the environment in general. So these are the broad areas that HHS covers, and it has a very big mandate. The key roles, in my opinion, is one, fostering sound science in medicine, public health, and social services. Now, why is this key? This is important because in medical science, and as a physician, I'm having to use medical science to make decisions for my patients. Unfortunately, in standard medicine, doctors, the science that they're exposed to is controlled by corporate industry. So the pharmaceutical companies, the device companies, they actually not only sponsor the medical science that we use to make medical decisions, but they also control the science. So when a study comes out on a drug, a pharmaceutical company who's making the drug, who has incentives to sell the drug, will design the study. They have their scientists, formulate the study, and they may have hired physicians who are on their payroll to oversee the studies. And then they may get university professors who are paid by them to sign off on the study. So you get New England Journal articles that come out and say, well, this drug is this beneficial, it does this, that, and the other. Well, these studies are often manipulated to create a positive outcome. And so this is something that's run rampant in medical science these days. And many universities, many of the science work that they're doing is not studies that are created by individual questions, by clinical observation, but the studies that they support and that they are carrying out are studies that are initiated by pharmaceutical companies or device companies. And this is what's populating our medical journals. Same thing for public health and social services. Recent immunization vaccines. The study of the recent vaccine for the coronavirus was published and controlled by the companies making the vaccine, where there's a natural conflict of interest. So it's very important for the Health and Human Services to come out and say, look, we need to disrupt this approach. So this is a very, very important a role by HHS, and hopefully this is a change that can be a paradigm shift in terms of the way we carry out medical science. So this, I think, is very important. It's a key and important role that the government can take. Overseeing what goes in our food, water, and air, again, important. You may have recently read or heard about the banning of the red dye. Now, that's sort of preemptively done because, red dye, I think it's red dye number 8, I forget which one it is, recently banned by the FDA. Well, is that, a signal of the fact that the new HHS is coming in? There's going to be more bans on certain dyes. But the chemicals in the food, the chemicals that are allowed in the food in the United States are banned in other countries. And so we suffer cancer rates and obesity rates and other chronic illness rates among our children just based on the cereals that they're eating and the like. So overseeing what goes in our food, our air, our water, is going to be very important. And so these are the key roles that the government can play that I think that's, primarily what they can do. We can't control this as much other than by, calling our representatives and trying to influence at the grassroots level. And I think there's a lot that we can do there as well. So the key to achieving both these two initiatives is really to remove corporate influence, as I said above. If we have a way of removing corporate influence from government policies, that can allow for sound decisions to be made without conflict of interest. So what is our responsibility? And I think this is the most important part because it's our responsibility that we have the most control over, and that gives us the most power to enact our capabilities of improving our health. Number one, we really need to educate ourselves about how to optimize and maintain our health. This is the day of information. There are many patients come to my office and, they may not have done the background research, in some cases, understanding how the heart works. They'll come in referred by their primary care physician. They may not know why they're being referred, etc. On the other hand, the other patients come in, they're well knowledgeable about their disease state, well knowledgeable about issues related to the heart or the kidneys, or whatever the case is. They've done the research. They looked at alternative treatments. They looked at standard treatments. You have to be aggressive and educate yourself. If you don't have a strong scientific background, get a family member, get a neighbor, someone who does, to help educate you about how your body works, how to optimize your health. This is the first step. You have to constantly seek professional resources to assist in maintaining your health. What I mean by that, example, we're a resource in terms of, doctors and medical experts who not only understand standard allopathic medicine, but who also look at nutrition in allopathic ways and supplements. Find, massage therapists, exercise experts, herbalists, research these people, go online. This is the information age. There's lots of information available. So seek out individuals, professionals who can assist you. And, you may not always find the person on the first try. You may have to search multiple different times, but try to get a list of professionals who can assist you and coach you along the way as you do your own research and investigation. So you're putting together a team. First of all, you is the first part of your team, and changing your knowledge base about how to optimize your health. So health is the first step. The next part of the team is get some professionals around you from whom you can get information and get some guidance to assist you in optimizing your health. Again, as I said, best medical health and wellness experts, best sources of food, hydration. When I obtain food, I just don't go to the supermarket and pick up the first thing I see on the shelf. I may go online and say, Google organic breads or gluten-free this or gluten-free that, organic fruits. Many of the foods I have shipped to me because oftentimes it's not available to local supermarket. That may be local farmers markets. What's the best source of hydration? What's the best source of juices to drink, whatever the case is. This is all part of your educational process. And once you go through that, you want to seek out the best resources of the food and try to integrate optimal health habits in your lifestyle. We all know that, proper sleep, exercise, eating healthy are important. If you have a busy lifestyle, you want to make sure that you schedule in time where you can have healthy food. Don't just eat anything that's available. If you have a busy schedule, busy week, you may need to prep out ordering your food or prepping your food ahead of time. But your lifestyle has to be integrated into the healthy habits have to be integrated into your lifestyle. Exercise needs to be integrated into your lifestyle. So these are things that you have to do on a regular basis. And you have to be intentional about making these healthy habits. But, and the other component is really important, you have to be willing to make necessary investments in your health. Oftentimes I hear from people say, well, healthy foods, too expensive. Well, healthy food may be too expensive, but cheap food is more costly. So maybe you can't afford all the organic foods. However, look at your total budget. Maybe spending money somewhere else where you can divert that toward eating healthier food. I've seen people come to my office and they've gone on this cruise and this trip and that trip, and then we recommend a health plan. They'll have the resources for that. Well, I'm not saying don't take a trip, but in order to be able to enjoy life better, you need to invest in your health. And so look at investing in your health as a proper investment. Just like you look at investing in stocks and bonds or other types of resources, investing in your health is really, really important. So what about overall thoughts on the matter? First and foremost, this new national conversation about making America healthy is welcome, though it's long overdue. However, we must influence our government leadership to follow through on these initial proposals. We can't just sit by and say, okay, this is proposed, call your congressman, get involved, learn about what's happening, learn about these initiatives, go to the MONTGOMERY website and look and see what's happening at the national level and see if these policies are being followed through on. But most importantly, we have to realize that most of the power and responsibility for our health relies with us. The things you do on a day-to-day basis are going to have a bigger impact on your overall lifestyle than what the government can ever do. Even though they have an important role, the most important role is with you. So that's why here at Montgomery Heart and Wellness, we focus on empowering our patients, the thousands of patients that come to our center every year. We empower them and by educating them on how to optimize their health. The tens of thousands of patients we interact with nationally, internationally, online, we empower them and educate them to improve their health. So it's our vision in 2025 to further educate our clients and our patients in terms of how you can optimize their health. That may be anything from a handout that has a nutrition plan. We come up with multiple plans in terms of how to carry out your health in a more elaborate way. We want you to be your own medical expert. The more you become your own medical expert, the more empowered you are, the less you have to rely on a healthcare system that's compromised by corporate interests, and that, in my opinion, at this point in time, unless it's turned around, is on its way to a rapid demise. But don't become victim to that. Start empowering yourself today. So what are we going to do? Our initiative in 2025 is the following. We're putting out more resources through our clinical rounds. So many of you are familiar with our clinical rounds. Clinical rounds 1.0, as I'll call it. It's going to undergo some upgrades. We're also coming to clinical rounds 2.0, which is where we're going to bring you into our clinic. This is going to be a very unique way. And we're going to show you how we work with our patients, how we think through medical and health problems, and how we put them on a healthy course using nutrition, other natural ways, adjusting medications. So you have insight to that. I think that's going to be a very important educational piece. I'll also come on and have more live shows talking about healthcare topics where we can discuss what's going on, help you interpret what's in the news. And I also have a live session Q&A where you can raise questions and comments, and we'll address questions and comments that are placed on our channel as well, so we can directly educate you. Now, a special event is going to occur in about 2 weeks. It's going to be February 1st, I think it is. I'm going to bring Jackie on. She's going to be helping me out to make sure I don't say the wrong thing. And welcome, Jackie, to the stage.
Hi, Dr. Montgomery.
Good morning. Good morning.
Good morning, everybody.
We fill questions out. The premiere is going to be the first Saturday in February. I think that's February 1st. Is that correct?
Yes, it is.
So we are releasing a YouTube premiere of episode 1 of season 1 of Heart and Soul of a Champion. Heart and Soul of a Champion is a docuseries we put together. Many of you are aware of this docuseries. It's been available on our website. We're releasing a premiere of episode 1 on YouTube, so that the whole world have exposure to it.
Of season 1 or season 2? Season 1?
Episode 1 of season 1.
Okay.
So episode 1 of season 1.
Mm-hmm.
And you have a chance to see that. And Heart and Soul of a Champion is designed to help individuals learn how to come and reclaim their health. The reason we label it Heart and Soul of a Champion, season 1, we brought in some athletes who were well past their prime. And these are athletes that played in the NFL. One's an NFL Hall of Famer. They were world-class athletes in track and field, played level 1, D1, Division 1 football. And they all had championship performances at some point in their life. Now they're in their 50s and 60s with chronic illnesses. And so the goal was, could they regain their championship form? And so we took them through a process of nutrition and fitness, etc. And you get an inside look at their day-to-day journey through this process to get back on the athletic field and see how well they can perform. So you get a look at episode 1 if you want to register, look at the entire season. You have the opportunity to do that. Again, this is going to be February 1st, 2025. This is roughly a week, 2 weeks from now. And then 1 week after that, that Saturday, I'll be on to do questions and answers about what you saw in episode 1 and answer questions about the other part of the season. There's going to be a link to the premiere in the show notes of this show. So go there and take a look. And And don't just go by yourself. Invite loved ones, friends, and family. You want to do a viewing party, do it. Bring as many people you think will benefit from this to this, because I think it's going to be very important docu-series. But this is one example of the type of material we'll be producing in 2025 for you to help empower you to improve your overall health. So we look forward to getting your thoughts and insight in terms of what you see in episode 1. So I'm going to open up for questions and comments. I don't know if you've seen any comments, Jackie. We can, what I'm going to do is let you take
one comment that I saw a little bit earlier. So hi, everybody. Gary, Indiana. Connecticut. Good morning.
I see you saw red dye number 3 was banned, so I didn't remember the dye.
What's interesting to me is it was banned in cosmetics 35 years ago. Why is it still in our food?
Yeah.
And I understand that it's going to take them, they've given the companies 2 years to get it out of the food system. So we still got to keep reading the labels.
Yes. Yeah, that's an important thing. Read your labels. Reading your labels is important. And so that's important for everyone. Happy MLK Day. Some people are saying that. Yes, regulation on Wednesday ban, red number 3. Yep, nearly 35 years. Yep.
And I think Auntie Eva was saying when you were talking about medical journals, she said something about that's the corrupt aspect of it. So she was acknowledging that medical journals and even pharmaceutical science can be biased.
Yeah, not only is it biased. In fact, the pharmaceutical executives come out and say they admit themselves that the purpose of their research is for marketing. It's not for science. It's for marketing purposes. And so they do the research for the purpose of getting it added to the way it works is this. So we follow what's called guideline-directed medical therapy. That's a phraseology you may hear your doctors talk about. And so they're guidelines. So in my area of cardiology, the leaders of cardiology establish these guidelines. So let's say, for instance, heart failure. You have guidelines that if somebody comes in with a diagnosis of heart failure, you know, number 1, you put on this medicine, number 2, this treatment, number 3, etc. It's almost like a cookbook recommendation. Now, it's not absolutely strict, so they call it guidelines, but it's one of those things that it's one of those things that if you don't follow it, you know, you can be in trouble. So if you have a person in the hospital wants you to follow the guidelines, and if you don't follow the guidelines, you have to have a reason why you're not following the guidelines. So the guidelines, even though in a technical sense it's not an absolute law, from a practical sense it's almost equivalent to law. So, you know, and so essentially what happens is a patient goes into a cardiologist's office and they get diagnosed with heart failure. You look at the guidelines, they automatically get put on a certain set of pills. They go with diabetes, they automatically get on a certain set of pills. And many of you know what I'm talking about because it may have happened to you. You go in and say, oh, they just put me on these pills automatically. They do that because there's these guidelines. Or where do the guidelines come from? Well, the guidelines come from the medical industry. It comes from pharmaceutical companies. So the pharmaceutical companies that have the drugs they want to sell, they'll create a scientific study. They'll manipulate the study where they get a positive outcome. They pay the journals to publish in the prominent journals, and then they go to the scientific meetings, which they pay the sponsor because they pay millions and millions of dollars for the cardiology meetings or the endocrinology meetings. So they sponsor the meetings, and they'll have the announcements at the meetings that this drug showed this benefit. Let's put it on the guidelines, so it goes on guidelines. So then the guidelines become populated with drugs that are dictated by big pharma. So the science that your doctor's using isn't really science, but it's the commercialization. It's the marketing material from the big pharma. And the doctors don't get any extra money. It's just that the societies that they're members of are getting the extra money. So no one looks at things like nutrition and health and, certain herbs and things. Yeah, that's looked at, by people in foreign countries, and we look at it. We have lots of studies on nutrition, supplements. The other integrative care physicians have studies on this, but this is not done in the mainstream medical society. So this is where government can come in and disrupt this process. But the medication and treatment you're getting is not based on pure science or absolute science. There's some pseudoscience. I'll call it pseudoscience because there's some studies done, the outcomes that are found, but oftentimes it's manipulated, and the purpose is for marketing your drugs, not the purpose of finding the absolute truth of the best treatment for this disease state. And I think that's an important distinction to understand.
And can I ask?
Go ahead.
I was going to say, I just asked you a question. And what role do insurance companies have in the care that patients get? I mean, you might prescribe something, the insurance company might deny it.
Yes. So insurance companies, there's often a battle between insurance companies and whether it's a medical provider or hospital provider. There's often a battle between them, and they're trying to save money as well. So they may deny a new drug because it's too expensive. So there's some lobbying that goes on there between big pharma and insurance companies. So there's an interplay between insurance companies, drug companies, and device companies and hospitals. They sort of work out deals and things like that.
And so I just wanted to point out that Stephanie Leach said that she really enjoyed watching Heart and Soul of a Champion. Hi, Stephanie. And Two Dope Sons says he's moving back to Houston. So hopefully we'll see you in the garden kitchen or at the practice soon. Two Dope Sons.
Great.
Hemp Hands Soap asks, what does it mean when labels say bioengineered?
So bioengineered, basically, you go on and you can chemically change a chemical structure. And so bioengineered is sort of biological changes to a chemical structure, that sort of thing. So you go into a lab and you change a biological structure. That's bioengineering. Somebody asked if we take Medicare. The answer is we do. That's a quick one.
Yeah.
So it's manipulation of the chemical structure of a biological substance.
What do you think about what David is saying? Big pharma is in the pocket of our government, but anybody can talk the talk, but can they walk the walk? We have to take total control of our health. What do you think?
No, he's spot on. I mean, and that's the point I raised earlier, is that there's these initiatives that come out, and that's the talk, but we need to follow through and see if they walk through that, because there's a major amount of influence because big pharma, they have lots of lobbyists. They're probably the largest lobbyist force in Congress. They have commercials. They control lots of TV ads. That's one of the initiatives that's been talked about. RFK Jr. has talked about us banning the ability of pharmaceutical companies of advertising. If you take away those advertising dollars, you may take away the influence of media on promoting big pharma drugs. For instance, when you had questions raised about the previous, vaccine for coronavirus, those things were snubbed by the media because, they were sponsored by the big industry that sponsored these things. So, we have to start to cut into these lines of influence in a major way, and that's something that has to be done at the government level.
Okay. Now, David says in Russia, farmers get 20 years in prison for not growing organic vegetables. Why can't we do that?
It's a great question. Again, that influence that goes into the food industry. We want to do things quickly and cheaply. The bread that we make here is different than the bread that's made in Europe. Our bread is highly processed. Food is over commercialized. We spray glyphosate on most of the wheat products and the like. So again, our farming. So it gets into those policies. Those of you at the beginning of the talk, I talked about those areas where government has influence and HHS has influence in these areas. And RFK Jr. is promoting to cut into these various forms of corruption that we're seeing at the national level. And this is where government plays an important role. However, it's going to take a while for this to take place. So in the meantime, what we have to do is, as you pointed out, read labels, number one, and search food. Like, I don't buy regular bread from the supermarket. There's a bakery in Miami I buy my bread from. It's grown the old-fashioned way, using a traditional wheat that has a different type of gluten molecule than the standard gluten molecule. I may order to have other things shipped that's natural. Now, I'm not saying everyone can afford to do that, but to the extent that you can afford to invest in different things, go outside the box and invest in them.
Auntie Eva says, and this is an interesting point, med students receive very little education about nutrition as it relates to health overall. They focus on drugs. Was that your experience, Dr. Montgomery?
Yeah, that's been my experience. And I think it's probably the same thing that's going on now. I haven't kept up with medical education, but I look at it as a double-edged sword, because when I think on my experience, I'm glad I didn't get any education in nutrition, because they would have taught me the wrong thing.
Well,
so sometimes
right.
it's better to start with a blank slate and learn it fresh than to have to
Isn't that what Javon said of healthy vegan eating, that he started to take a registered dietitian class, and then he said, they're teaching me all the wrong things, so he stopped.
That's right. Yeah, you only get it to get your card stamped, just say you're an RD, and then you forget the information they taught you and just use the label.
That's what Jeff Novick did.
Yeah, that's the way to use it. But no. So anyway, I think this is great. This has been a great conversation, and these are great comments and questions.
Do you want some more questions?
You have more? Okay.
Yeah. Oh yeah.
Let's take about 2 or 3 more, and then we'll also, if for some of you didn't get your question answered or comment addressed, when I come and do the live session after the premiere.
So on February 1st.
February 1st, yes, because I'm sure people see this video. If you're looking at this video after we've gone live, feel free to put a question or comment in, because we will look at those questions and comments, and also go to the premiere. The details on the link is in this in the show notes here. But go to the premiere and look at that episode 1, because 1 week later I'll be discussing it. And then, of course, the premiere will be online, so you can look at it anytime after the 1st of February. But that next week, I'll be discussing question and answers you may have about the premiere, but also will address questions and answers and comments you brought about things we talked about today.
All right. So Ray May says he's not sure if this question is valid. All questions are valid. Does organic usually mean the food is safer than standard food that you get in the supermarket? If so, what is the difference between the two?
Now, that's a great question. Actually, I love that question, because, so I'm going to reiterate, does organic means it's safer than regular food you get in the supermarket? Well, it depends. Organic has to, in order to get an organic label, it costs money. So let's say I'm a farmer rather, and I'm growing foods, and I want to have my crops labeled organic. I have to pay a lot of money, have a soil test, and various other things. There's certain criteria I have to follow. However, if I'm a farmer, I'm growing things sustainably, I may be using growing techniques that are healthier than an organic grower who's just following a standard that he must meet to get the label. I may not pay the money to get the label, so my food won't be labeled organic. It's next to your food. It could be healthy. I remember talking to Dr. Nathan, I believe it is. We were talking about nitric oxide, and some greens that are not raised organic, it has more nitrite in it than greens that are raised organically. So they may produce more nitric oxide. So the organic label is not an absolute guarantee of it being better. I use it largely because there's at least some standard that's met, as opposed to thing that's unlabeled. I don't know what standard has been met. Ideally, you want to try to get it from someone, a local grower who you can talk to and understand what they've done with the food. You want to try to grow as much as you can on your own. Everyone doesn't have a big Garden Kitchen, we started our own gardens and many farms. And so we're starting to grow our own produce and other foods that we'll be selling out of our restaurant and our grocery store. And that's starting real soon. We got fruit trees are being planted and the like. So in the coming 3 to 6 months, we'll be pulling from our own resources. And I think I advise more people to do that. If you have a back porch, grow out potted plants. But do your best to get the best quality. Organic is one way. It's not an absolute guarantee, but it does determine that some standard has been followed as opposed to one that's unlabeled in the supermarket. You may not know what standard, if any, was followed.
So this is a fascinating question. Are there any insurance companies that support natural treatments? So have you ever encountered an insurance company that was willing to pay for the healthy food that you offer to patients in the Garden Kitchen?
Just in a limited fashion, yes. Some patients, they get reimbursed themselves. My take on this is the following. I really don't want insurance companies to support these things. I really think we should all take this personal responsibility. Once they start to support something, then they control it. And it's a matter of control. So if they pay for something, they start to control it.
Then they'll start telling you what to put in the food.
Exactly.
Or what to not put in the food.
Exactly. How much of you have. And then it gets in the psyche of the customer or the patient or the client. Oh, my insurance is covering this. So whatever they cover, I'll take, and whatever they don't cover, I won't eat. And so it's I think it's better for you to have to, take the responsibility of investing in your own food. Because if someone else has to do it, then they control it, and you don't want to do that.
Okay.
Yeah.
So Auntie Eva says insurance companies need to be reined in also. She says she knows of a person who was denied a prosthetic leg, saying that it was not necessary. They were or were not on death's door, Auntie Eva, I'm not sure. But yes, oftentimes things that patients need seem to be denied.
Yeah, that's the control they have. And it's a psychological control because people think because if the insurance won't cover it, they don't need it, or they don't want it, or whatever the case is. And that becomes very problematic. So
someone asked, do we offer telemedicine for people who live in other states?
Only if you made the first visit here. You got to see us in person once, and then we follow up with telemedicine or digital health.
Professor Bright says, he's essentially saying epigenetics is, so what is epigenetics?
Well, essentially, it's at the RNA level. So basically, your DNA is the blueprint of your makeup. And even that's not static, but by and large, it's a blueprint. So let me use the builder's analogy. If you want to build a house, you go to an architect and you say, I want the house to look like this, and et cetera. They'll draw a blueprint, a set of plans. So that's the DNA level. But then in order for the house to come to realization, you have to hire contractors, subcontractors. They read the blueprint, and then they replicate what's dictated in the blueprint to make a house come to fruition. So that's the building of the house. Well, that's the epigenetics. So a certain protein molecule is designed in your DNA, but you have to have mRNA to look at that DNA to then put together the amino acids and to make that protein come to realization. So the epigenetics is the actual building or the manifestation of what's in the DNA. So what happens is epigenetics can change or be affected based on your environment. So you may have the the genetics for diabetes, but the genetics for diabetes or the absence of diabetes is going to be controlled with the epigenetics. So if you're predisposed to diabetes and you expose your body to a bad environment, bad food, lack of exercise, etc., then the epigenetics of diabetes will be expressed. So the malformation of enzymes or adverse molecules will be expressed, or deficiencies in enzymes or molecules will be expressed in your gene, in your proteins and the like, such that you will have diabetes. But then if you expose the body to a healthy environment, healthy food, sleep, then those molecules, enzymes, proteins, receptors will not have those defects that predispose to diabetes, but also be functional. So then you won't have diabetes. So epigenetics is how disease states are expressed. So you can suppress the suppression of a disease state through suppressing the negative epigenetics through your lifestyle.
So can we drink green juice? Is it okay to drink it as a normal lifestyle?
Yeah, it depends on how you make it. But if you have healthy greens that go into it, I'm drinking a green juice now. It doesn't have any sweeteners in it. It has mint, ginger, parsley. It has a blue green algae and filtered water.
And that's in our kitchen.
Yeah. And just because it looks green doesn't mean it's healthy. Lots of green juice have one vegetable in it, lots of processed fruit.
And lots of junk. And they're pasteurized. So
yep.
Hopefully it's a green juice that you're making yourself, Mr.
Exactly.
Dripjo, because you don't want to buy one at the store.
Let's make a couple more questions and comments and we'll wrap it up.
Yeah. What's the name of the bread company that you're talking about? Get your bread from?
Joseph Bakery in Miami. Joseph's Bakery.
And it's the particular kind of bread. Is it the einkorn?
Yeah, they use einkorn flour. They use kamut, and it's fermented. They don't use yeast. But the einkorn flour is the traditional ancient flour. So is kamut.
Do you recommend a plant-based diet for arthritis? Now, osteo, rheumatoid, I'm not sure what they're asking, but it works for both.
Yes, that's right.
Why don't more whole food plant-based eaters use local farmers markets? I don't know.
I mean, it depends. I mean, the whole food plant-based community is not, there are different factions. Some people in the vegan community are just for animal rights, and some are just, low sodium, whole food plant-based. But there's more to eating. I mean, you hear about carnivore diets and various other diets, keto diets, paleo diets. Sometimes someone on a paleo diet may be eating healthier than someone on a vegan diet because they eat a lot of processed foods and junk food. And someone on a paleo diet may be eating as much, plant foods with a small amount of animal protein, but the plant foods they're eating are healthy, natural, and they're not eating junk food. So the label of the diet can take a back seat to what you're actually putting in your body.
Auntie Eva says she became vegan watching Dr. Montgomery and others in the YouTube community. She feels much better. She's lost a healthy amount of weight. Good for you, Auntie Eva.
Congratulations. Well, anyway, Happy New Year to everybody.
Yes. And do you want to talk a little bit about June 21st? And can I mention something about the online community before we end?
I tell you what, let's do that in our open session with Premier. We're going to have some announcements. I'm going to have some special videos going to give a lot of details. But just since you brought it up, June 21st, we have our Pure Food Conference section. You go to our website and you should be able to find it there, a link to it from our website. And we do have an online community. Go to our website and go to programs, and you can register for the online community. But we'll have much more to say about both of those in coming days. We'll be coming on live more frequently in 2025, addressing questions and commenting on medical news stories to help educate you, because we want to do more work to empower you in terms of becoming your own expert, medical expert. So stay tuned. And again, share this video. If you haven't come to this channel before, please like and subscribe. And of course, share this video with as many people as you can. The information we have here, we cited here, I think is important. And of course, share the information about the premiere on February 1st of 2025, in just about 2 weeks. And I'll be on 1 week after that, addressing questions and comments about the premiere, and also questions and comments that you may have left here. If it hadn't been addressed here today, many of you may be watching this on recording. Please leave a comment question, because we'll be watching those. We will address it in our last session in about 3 weeks from now. So anyway, thank you, Jackie, for being here, and thank you for joining us on our first live show. And I look forward to seeing you throughout 2025 And I'm looking forward to a great year to improve our health, regardless of what the government is able to do or not do. I think there's a lot of work that we can do at the
We have the
individual level,
control.
and you have the control, and that's our mission, is to give you insight in terms of control that you have. Until next time, take care.
Bye, everybody.